There's so many medical specialties. How in the world do you decide? Welcome to MedBreak. My name is Sam. I'm a resident physician at the Mayo Clinic. And today we'll be discussing how a undifferentiated medical student, like a pluripotent stem cell, differentiates and chooses his or her specialty. We'll first be talking about those flowcharts out there in the internet, followed by some common pitfalls to avoid when you choose a specialty. And then I'll talk about the major considerations, and then less important but still important considerations when you choose your specialty. So apparently there are some flowcharts out there on the internet that has people choose their specialty based on their personality and by answering some yes or no questions. And these are unbelievably useless when it comes to choosing your specialty, but they're really funny. So let's take a look. I usually like to give credit when I find something like this, but I really couldn't find who made this one. So looking at this chart, we'll focus on what I chose as a specialty, which is radiology. Are you a people person? No. Are you secretly a vampire? Yes. And if you want to keep it a secret, then you become a radiologist. And I can see why they talked about becoming a vampire, because radiologists work in the darkroom a lot, which is true. But, you know, in all practicality, this is ridiculous. Looking at the next one, again, radiology is down here. As a medical student, are you crazy? Then you can go into psychiatry or emergency medicine. But if you're sane, but if you're hardworking, you can go into some other route. But looking at radiology, not so much. And then if you're afraid of the light, then you go into radiology. Again, radiologists working in the dark room, when they read those images, they're playing off that joke. Here they talked about who made this chart. Given how stupid these are, I think this one is probably the most accurate. So radiology is down here. If you like everything, family medicine, probably true. If you like nothing, there's nothing in the between. You can't like some things. It's either you like everything or you like nothing. How are your grades? Your class hates you. I wouldn't say my class hated me, but I can see why some people wouldn't like me. Do you like to cut? No. Are you socially awkward? Then you go into radiology. So that is true. So you can play along this chart and see where you land. But again, these have zero practical values. There are also some question-based surveys out there, and you plug in your personality or you answer some questions, and in the end, it spits out a specialty for you. These are all ridiculously useless, but they're kind of fun to play around with. I admit I played around with them too when I was choosing my specialty. For those of you who are interested, I'll put the links to some of those surveys in the descriptions below. The fact of the matter is, according to a survey done in 2018 of residents, about 75% of medical students change their preferred specialty during the span of medical school. And this is understandable. You know, you're trying out different things, see what you like, see what you don't like. When you're on your rotations, you might have thought you were going to do one thing, but turns out you like something else more, so you go with that. It would be very problematic if, let's say, 90% of medical students didn't change their specialty. They knew exactly what they wanted coming into medical school, and that just doesn't make sense. You get so much more exposure during medical school, and you hone your interest, and you just learn more things. The issue is, according to some survey done in 1970s and 1980s, so a really long time ago, about 20% of residents changed their specialty during residency. And even more alarming is, according to a different survey, up to 16% of attending level doctors changed their specialty after they finished residency. I'm guessing that these numbers kind of decreased in nowadays, but still like a 5% of physicians or residents change their specialty seems a lot to me, considering how many of them there are. So I'd like to talk about some pitfalls to avoid during medical school when you eventually decide your specialty. There's no algorithm you can follow that'll tell you exactly what you want to do. Of course, the most correct answer is you check them out during rotations and ask some people who are doing that thing and see if you think you'll be a good fit. Even so, I can see how a lot of medical students can make some of these mistakes. So the first mistake is choosing your specialty way too early. Some of medical students coming into medical school know exactly what they want to do. They're like dermatology or die. Or they went to medical school to become an ophthalmologist. Maybe you have some family medicine doctor who are your parents and they've inspired you to go into primary care. Or you may think being in the OR and performing surgeries is like the coolest thing and you want to do exactly that. There's no problem with you having a direction even early on. But the problem could arise where you focus all of your attention thinking you're going to do one thing, but then come rotation time in the later part of your medical school career, you realize that you really don't like that thing, you don't like being in the OR, or you think something else is even cooler. Maybe you didn't think you wanted to specialize as much as doing something super niche. So you could be spending a lot of time and effort pursuing something that you're not going to become. So in general, it's good to go through medical school thinking that you're going to do that rotation you're on forever. Just pretend you're going to become that thing just to be able to explore it to full extent, even if you think you know what you're going to do going into medical school. The next pitfall you heard before. You've heard it once, you've heard it 100 times. Do not follow the money. There's some specialties that pay you a lot better than other specialties, but everyone knows that money doesn't make you happy. Everyone knows that you need both money and fame to become happy. The next pitfall is choosing your specialty based on a certain attending that you like or don't like. You might really like this attending because that person is really inspiring. He or she is really into medical education and really looks after you and really cares about your career. And you might want to go into whatever he or she does. However, that's not an accurate depiction of that field. Of course, they can inspire you to check out that field, but that shouldn't be the deciding factor. Same thing for meeting a attending or a resident who you don't like during a rotation. Maybe you're checking out neurology and there's this really nasty attending. Don't let that one person ruin that experience. All of these fields people have chosen above other specialties, so give it a fair chance. Last pitfall to avoid is deciding based on the prestige of the field. Maybe it is classically known that it's really hard to get into that specialty, maybe like neurosurgery, dermatology, or orthopedic surgery, and you just want to go into it because it's hard to go into it. You want the respect of your peers and other doctors and think really highly of yourself, but in the end, that is a formula for failure. Maybe in like 30 years, at the peak of your career, that specialty is one of the easiest ones to go in, but that's not even a thing to consider. Next, I'll be talking about the most important considerations when choosing your specialty. The first thing I want to address is consider whether if you really need to specialize. And I'm talking about choosing to become a primary care physician, either in pediatrics, internal medicine, or family medicine. There is a demand in the US, especially in rural areas, for primary care doctors. It's not something I can speak too much on because I myself did not go into primary care, but there is a demand and a lot of patients need the access to healthcare. One of my friends who went into family medicine does not like the question, what are you going to specialize in? Because that puts an expectation on medical students that they will eventually specialize, when in fact they don't have to. But that's all I can really say on that matter. The next important consideration, and this is for all practical value, is your board score. You might want to become a neurosurgeon or a plastic surgeon, but if you don't have the score to get in, then it's not really practical for you to really pursue it. So that is the major dividing point in choosing your specialty. It's really pointless to talk about what you want to become before you take that step. So when step 1 becomes a pass or fail, that step 2 CK score will become more important. Having said that, getting a less than ideal board score is not the end of the world. There's still ways to make impressions to be able to pursue that field. Maybe you won't be able to choose what kind of program you get into or the city that you're going to become a resident in. For example, even if your board score isn't quite there, you can talk to that program director in your own school, so let's say ENT, and you want to make an impression on the program director who ultimately decides with a committee whether to accept you or not. You can, establish a rapport early on and say, I know my score isn't there. Is there a chance that I can get into a program, including this program at my school? What can I do? So have that conversation even if you think that your board score isn't quite there. If you must pick a specialty to give yourself a sense of direction before you take your step, then prepare for the most difficult specialty out of everything that you like, because that'll push you to look for those research opportunities and do better in school. It'll motivate you to achieve higher in one sense. If I had to construct a flowchart to help medical students decide what they want to be, the only branch point besides the step score would be whether you like the OR or not. Everyone thinks surgery is very cool, but it's a different story whether you can be in it and work in that environment. You really have to love the OR and love working in it and love the process of surgery to pursue a surgical field. If you don't like surgery, even if it's a pretty minor part of that eventual specialty that you're going into, still, you'll hate that part of it, and it's a major part of your training anyway, and you don't want to become a surgeon who doesn't like the OR. So that's the only major branch point. I think the most important consideration out of everything is the pathology of that field you're going into. Do you like the disease process that you'll be treating? And do you think you can work with that disease for the rest of your career? You really have to think that disease that you're treating is interesting. You can't think that it's mundane or boring, that most things that you learn in medical school is interesting, but can you dedicate your life to treating this class of diseases? For example, in ophthalmology, you really have to think that vision is really important, probably the most important thing in your health, and eye diseases fascinate you. If you're going to orthopedic surgery, then you'll be dealing mainly with diseases that pertain to the bone, a lot of fractures, a lot of joint diseases, and the muscular system around it. So you have to think all of those are cool for you to really pursue it as a career. Kind of along the lines of liking the disease process that pertain to your field, you really have to like the philosophy of your field. Meaning, what is the role that your specialty plays in healthcare in the big picture? If you're a primary care physician, then your primary goal is to keep healthy people healthy by preventing diseases, going through all the screening guidelines and keeping them healthy even through as they age, when things start to break down, helping them manage their health conditions. Also, if they do get sick, seeking the help of these expert consultants in other specialties to help manage this patient to make sure that you maximize their quality of life. This is really different from specializing in the eye as the ophthalmologist, because you learn a lot about how to manage disease of the eye and perform microsurgeries. That is very different from what a primary care doctor does. In radiology, radiologists help their other doctor colleagues by help arrive at a diagnosis and performing some procedures here and there to move along the process of getting their patients better. But they're not the primary ones taking charge of the patient's health. Again, you have to like what your field does, what the role is in the grand scheme of things. Now, let's talk about the less important but still important considerations when choosing your medical specialty. First, I encourage you to think about the private side of that field. As a medical student, you are exposed way more to the academic medicine because you're at a school where the whole point is to make you into amazing doctors. You are exposed way less into the private sector, and there is a larger group of physicians who are in the private sector. Whatever field you want to explore, the private side of it is much different. Private anesthesiology is different from private family medicine or private general surgery. They're very different from private radiology. You can find out more about the private side of medicine by still shadowing. I'm sure your attendings might have connections to people that you might be able to shadow just to check out how things are in that area. Your shadowing experience does not end once you get into medical school. It's still something you can do to help you decide something you'll do for the rest of your life. Another thing to consider when choosing your specialty is the type and the amount of procedures. Just because you're going into a field that doesn't perform surgeries doesn't mean you won't be doing procedures. Basically, I think every field involves procedures, maybe with the exception of psychiatry. And even in psychiatry, there are some procedures that are involved if you want to. Make sure that you're okay performing these procedures and you think they're interesting for you to maybe become experts at it later down the road. For example, some people entering medical school might not know this, but in diagnostic radiology, it involves more than just sitting in a dark room and interpreting imaging to come to a diagnosis or help the ordering provider. There's actually a lot of procedures involved that I feel like if you don't like performing procedures, then you really shouldn't go into radiology because you'll be doing a lot of it during residency. My point is, explore the field enough to find out what kind of procedures they perform routinely and that you're okay with it. Another thing to consider is the length of training itself. No matter how much you love a field, maybe if it takes 8 years to become that, maybe you don't want to pursue it for that reason. You might go for the second next best thing, which is, right there with your first choice. In my part 2 of Do Not Become a Doctor, I talk about all the important things that happen in your 20s, basically the time that you're in residency. So if you want to have a certain type of lifestyle outside of medicine during your late 20s and maybe into your early 30s, maybe not go into a specialty that will take up all of your time. kind of on the topic of having the lifestyle that you want, I think a major thing that is really disruptive to your lifestyle is being on call. If you're on call, then you might be at a moment's notice of having to run to the hospital or giving that patient a call because an emergency has happened. Basically, the less call you have in your life, more flexibility and planning you're able to do in your life outside of medicine, so you can do some of the more social things or some of your hobbies, plan longer vacations, things like this. Of course, this is the most important consideration. For those of you who think lifestyle is very important, then this is something that you might want to consider a little bit more. The last thing on my list of less important things to consider is compensation. The money. I know I said that don't choose a specialty based on money, but does it influence some people to choose a certain specialty? Of course, that's undeniable, and that's all I can say about that. My final message is this. I know it is kind of unreasonable for medical students to be expected to choose a specialty that'll affect the rest of their career within 2 to 3 years of starting their medical school. And there are things that you can do and things you can avoid to make sure that you pick a field that aligns the best with you. So keep an open mind in your medical school and during your rotations, even if you have a pretty good idea of what you want to get into. Become really involved in your rotation and pretend that you're going to do that rotation for the rest of your life. And then, once that rotation's over, move on to the next thing. And during this process of becoming super involved, you'll learn that you'll really like some things and you'll really not like certain things. You can always ask your mentors about how they chose their specialty and maybe ask for some contacts to do some private shadowing too. Although it's not ideal, there are always ways to change later. You know, the whole reboot the system version is where you just quit the residency altogether and reapply to go into a completely different specialty. But this is not something you want to do. Let's say you want to include more procedures in your field. There's always ways to do that, or avoid procedures. Maybe you want to specialize even more and just work on this one specific subspecialty of that specialty. That's possible too. For example, there's a subspecialty of the specialty of radiology called interventional radiology. You can get into it by 2 ways, basically. You can match directly into interventional radiology, or you can enter a diagnostic radiology program and then decide to specialize in interventional radiology. An even more subspecialized version of interventional radiology is neurovascular interventional radiology. They would do something like if somebody gets a stroke and there's a clot in someone's artery in the brain, they'll go in with wires and tubes and plunk that clot out. It's really cool. So you can do that through IR or by becoming a diagnostic radiology resident first, but you can also do that through neurology and then matching into a fellowship called neurovascular interventional radiology, or you can do that as a neurosurgeon. So there's many different paths that overlap, and it's easy to make switches to do something that is more in line with what you like. In the end, if you really don't know what you want to do and it's almost time to apply to residency programs, I feel like the answer is internal medicine. Once you become an internal medicine resident, it'll give you an ample time to explore other things you can do within that field that you can choose as a fellowship, like cardiology and GI if you like to do procedures. Maybe you can just do internal medicine and become a hospitalist. Maybe you can just focus on becoming a primary care physician by working primarily in the clinic. I don't know, there's a lot of options in that field. I hope you found this video helpful. In the end, do whatever you want to do, you'll be fine.
1, 2, 3.